talk about a medial collateral ligament injury and a lateral collateral ligament injury, a lot of times people get confused because they just memorize what's on paper, but then it's very, very easy to confuse the two because the tests that are done sometimes can sound exactly the same. So I just want to start off by discussing what this does, what the function of the medial collateral ligament is. And what the medial collateral ligament is, it is basically a band that is kind of located, actually this is not a true accurate depiction of it because it's slightly behind the medial side of the joint. And what it does is it functions to resist the knee becoming in this position. So this is the valgus position. So this thing is there so that if something hits you like this, you won't become like this. Now, the lateral collateral ligament, conversely, is also there to resist forces. So if you have an acute force on this side of the knee, the lateral collateral ligament is going to make sure that your knee doesn't become like this. Well, actually, you know, this drawing is not really correct because this leg wouldn't be affected. But anyhow, I'm showing this is varus. Okay, so varus is the stereotypical bow-legged position. So a lot of people get these mixed up, and people try and come up with different acronyms. So all you need to remember is varus. There's a lot of room between the legs. And so you'll know, if you know that, you'll know valgus is the other one, which is knock knees. So this is a knock knee. So if you're suspecting an injury, and oftentimes it's people who are not just with acute injuries, but people who have severe arthritis who are 10 years or 5 years post a suboptimal total knee replacement. So you can also have these problems in those patients. So if you're suspecting either an MCL laxity or injury or an LCL laxity or injury, there are two tests that are, you know, very simply named, and they are the varus and valgus stress tests. And what do you know? And I think this is where people get confused, because what you do is you have the patient extend the knee or extend the leg, and what you do is, in the case of the valgus stress test, you're going to put one hand here to almost abduct the leg, and you're going to put another hand here to put force, the same kind of force that's called a valgus force. So if this part of the joint opens up, that means you have a positive valgus stress. And that's a diagnostic clinical exam finding in an MCL injury. So conversely, when you're talking about when you suspect that there's a laxity or injury to the lateral collateral ligament, you're going to put your hand put your hand to adduct the leg and put your other hand to apply a varus force. And of course, if this opens up, you've got a positive varus stress test. Alright, so thank you for watching my video. Please subscribe.